Thank you again for joining the Heidelberg Engineering Academy. Now, without further ado, I'm pleased to present Tim Steffens.
Hello, everyone. Just want to welcome you to the session here of achieving the optimal OCT scan on the SPECTRALIS OCT. Just a quick overview again. We're going to be talking a little bit about some OCT technology, a SPECTRALIS overview, some 5.1 software that should be released soon, and then we're going to really get into the meat of the course here, talking about ergonomics of taking images, and image acquisition and optimization itself, and then we'll also go into follow-up scans. Quick overview of OCT. Time domain OCT has been out for quite a while. The big thing here with to take away from these next two slides is that time domain OCT acquires images slower because where the reference arm is, the mirror actually moves back and forth, and that mirror is what actually takes the image. So as it moves, the image is taken, which is more susceptible to motion artifact also. In spectral domain OCT, that reference arm, or that mirror does not move at all. It actually stays fixed, so the images are acquired much faster. The big difference with the SPECTRALIS OCT is we have an eye tracker, right, which actually allows us to scan the exact same spot every single time. So not only do we have the advantage of the mirror not moving, but we have the advantage of the eye tracker itself, which gives us greater resolution. In this particular image here, you can see everything really from the nerve fiber layer all the way down to the choriocapillaris. And you can really detect the inner and outer photoreceptor segments in the RPE, which is really what we're looking for in a lot of diseases like AMD and choroidal neovascularization. A quick SPECTRALIS overview here. This is a new OCT. You'll notice that where it says fixed mount, that part of the optical head is fixed. You cannot tilt or swing it on the SPECTRALIS OCT like you can on the OCT Plus or the HRA OCT. This is a little bit more of a scaled down version of our OCT Plus, and you're just not allowed to move the optical head. And you'll notice that on the joystick itself, you can activate the eye tracker and take the picture on the joystick here on the HRA Plus OCT, sorry, and the OCT Plus. You're going to be activating the eye tracker by the black button and also taking the picture via the acquire button. This 5.1 software update that's going to be released soon is going to have some segmentation lines that can be exported. So if you're looking at a particular scan and you want to export it as a JPEG or a different format, you can export those segmentation lines even in a volume scan. The angle, you can now also angle the volume scans too. So if you want to tilt the volume scan just a little bit so that you are sure that one of the lines goes through the fovea and the macula, you can do that. You can also freely move the volume scans now. You can grab the center of the scan and you can move the volume scan wherever you want to within the HRA image. You can also angle the single line scans. The posterior pole, on the new software, which you'll see here in a little bit, there is a scan called the posterior pole, which actually brings the size of the scan to our largest scan, which is a 30 by 25 degree image. You can then view that in the thickness map tab in the viewer software and get specific measurements in specific areas, whether it's a 3 by 3 or a 6 by 6 degree grid area. And Denise Arminger, who's going to be giving another presentation here in a couple of weeks, is really going to delve into that kind of stuff. Also on the 5.1 is a preset scan pattern. So now you can do either one. You can click on the volume scan and you can manually increase or decrease the size of the scan by using the arrow keys on the keyboard, or now with the preset scans, you'll be able to press on different types of scans to get these different sizes and different configurations. You can also customize scans, which is going to be great for specific physicians who like to have a specific scan with a specific disease, or if you're doing a lot of studies with reading centers, you can customize scans for the reading centers. So all you have to do is just click one button, and there it is. You have a larger live fundus image, and you also will have a centering target for the RNFL scans, which we'll show you in a little bit. And you can also export your data as an XML file, which is really nice for anybody who's doing any research, so that you can then import the data directly into Excel. You can do follow-up scans in any modality at all. So if you take a photograph, an OCT as an FA-OCT, and then the patient comes back a month later after having an injection, you can then follow up that scan with an infrared OCT. So whatever modality you use, you can follow that up with a different modality. So like I said, if you do a fluorescein OCT first, you can follow it up with a red-free OCT or an infrared OCT. The next thing is the segmentation lines are also editable down to 3 points. If you want to change the segmentation line, you previously had to right-click on the line and then either add a point or delete a point to move it. Now you can right-click on that line and you can delete all but up to 3 points and then just move the line from there and add points in as you see fit. You can also, on the thickness map now, exclude B scans. If for some reason there is something wrong with one of the B scans, the patient may have moved and the image got cut off a little bit, you can exclude that B scan from the thickness map itself. So this is what the new interface is going to look like when you actually take the scan with the new 5.1 software. It's a new graphical user interface. You can see there's preset scans and there's user-defined scans, which are the custom scans. The scan area now has been moved slightly over to the right and is larger. And you can notice down on the bottom, you can turn on and off the OCT by the button on the screen. For those of you who have a control pad or a touch panel, you can still do the same thing via the touch panel. You can either do a lot of this now on the screen, or you can do it on the touch panel the way that you used to do it. However, if you do want to use the presets, you do have to use the mouse and press the buttons on the screen. There's also, for those of you who are going to be doing this on the screen, you can move the internal fixation target around just like you would on the control panel. But now it's going to be done just via the screen. Larger live images. This is really nice so that when you're actually taking the picture with the eye tracker on, you're able to see the images a little bit better. You can focus on them a little easier. The HRHS selection is for high resolution or high speed. So if you want to go to one or the other, you can just press that button there. And again, there's the fixation target. Next to that is the OCT button. If you unselect that, right now it's selected because you can see where it's pushed in. If you unselect that, you would just be doing a fundus photograph or a fundus image. This is here an example of the angled scan. If you notice on the right-hand side, it says 11 degrees. So that scan there is tilted 11 degrees, and it will go in half degrees as you start rotating that scan line around. Okay, again, this is just another example of a slightly larger live image when you have the eye tracker active. The line scan now is also variable from 15 degrees to 30 degrees. So you can grab the tip of the arrow and you can either shorten it or you can lengthen it. And again, if you grab the tip of the arrow, you can angle it up or down. Here is an example of taking a volume scan, and you can actually physically move it around on the screen to where you want to do it. So this is going to be very similar to what you're going to do with the RNFL scans that you may already be taking. What we like to do is to get that fundus image looking really nice and clean, you're going to activate the eye tracker. Once you activate the eye tracker, that's going to stabilize that infrared image. Once that image is stabilized, then go ahead and position the volume scan where you want it. And once that image is stabilized, nothing's going to move. You can assure of the exact positioning and location of where that volume scan is, and that you're going to scan the correct spot. Once you have it positioned, you click Acquire, and you get the data that you need in the shortest period of time. Also, the volume scans can now go vertically also. if you notice in the on the right-hand side of this image here, it says 90 degrees. There's an arrow that points to the right horizontally and one that points up vertically. If you want to scan vertically, all of your volume scans, you can just click on that button there, the up arrow, and that will allow you to do your volume scans vertically. So now we're going to talk a little bit about ergonomics of imaging. The SPECTRALIS and all of our instruments don't have an eyepiece. So what a lot of people have a tendency to do is to, like this photographer here behind the camera, he's got his kind of his head and his body tilted towards the monitor so that he can see it. Well, what this ends up doing is if you end up doing a lot of images during the course of the day, you can, your neck or back, you can get a little tired. So what we like to do is to turn the body a little bit more towards the monitor, and this really allows you to see how the patient is positioned in the camera, make sure that their forehead is up against the bar, and you can also see the screen at the same time. Right? And it allows you to really, if you're using the touch panel or if you're using the mouse, you can take the mouse and put it to where the touch panel is. So if you have to let go of the joystick, right, your left hand here, you can hold on to the base of the camera, just to hold that there, and you can reach for the mouse, you can reach for the control pad. Okay. Now, real important stuff, camera alignment. This is really about 90 to 95% of what you do is going to hinge on the camera alignment and the patient alignment. What you really want to do is bring the patient to you. You don't want to have to go to the patient. What I like to do is to align the camera with the red line up and down, up and down. Then I have the patient put their chin in the chin rest and then adjust the chin rest up and down so that if their pupil happens to be low in the screen, right, I'm going to adjust the chin rest so that their pupil is about in the middle of the screen. Right, once I do that, then I adjust the table for the patient's comfort. Right, now at that maximum range of motion, if a patient opens their mouth, I can take that joystick and I can twist it and turn it and move the camera up, okay, or move it down if the chin starts sliding out of the chin rest. So I have maximum range of motion up and down. Okay, image optimization. Once you get that patient seated in there just the way you want to, as you start to move the camera forward, you'll notice that you'll get this little bit of speckle here in the center of the image, and you've got some vignetting there on the corners, on the black corners. As you move forward, you'll introduce more speckle. You'll also introduce more of that speckle or noise as you notice you start to focus. When you focus, you want the brightest image possible as well as the sharpest blood vessels possible. So you'll see that when you focus, if you turn the focus knob all the way to the right or to the left, you'll notice the image gets darker, right? And each laser is going to have a different optimization because of the different wavelengths. So if you focus to the left and it gets dark, and you focus to the right and it gets darker, somewhere in between there is where it's going to be optimally focused. And what we're going to do then is once it's optimally focused, we can turn down the sensitivity with the arc button. We can spin that and turn that down. If you happen to own an OCT, right, not an OCT Plus or an HRA OCT, it's an auto brightness and it will automatically turn that brightness down for you. Right? So like I said, if you focus on the HRA image, you may introduce a little bit more speckle, and you're going to turn that art knob down a little bit to control that brightness or that speckle. And again, on the OCT, it's an automatic brightness, so that is already done for you. Right? So the key of what we want to look for is we don't want any vignetting on the corners. And if you notice in picture letter A, the corners are a little dark. We don't want any area washed out, as in picture B, right? Because we're going to overexpose that area and we're going to lose detail in the image. So we want real nice evenness of illumination is what we're looking for. Now, when we do the OCT, once you get that image, that HRA image looking good, if you just move the joystick forward a little bit, your OCT will come in. And you'll notice here, what we don't want to do is we don't want a mirrored image. Right? We don't want to flip that upside down. We also don't want to partially image OCT. Right? So sometimes, if you get too close to the eye, it'll partially flip over. In the letter C, you'll really notice that this is where we optimally like to have the images, about in the upper third of the frame. Right? That's where we're going to get the best penetration into the deeper parts of the retina, like the retinal pigment epithelium and the choroid, and it's going to give us the best image possible and reduce a lot of the noise. Right? Once you get that image set exactly where you want, sometimes you'll notice that on the left-hand side or the right-hand side of the OCT image might be a little bit brighter or darker than the other. Well, what that is you're either clipping part of the iris or you're not quite in the center part of the pupil. So what we need to do is if on the left and right-hand side the image isn't optimal, it's a left-right hand movement with the joystick. Right? The other thing to look for is the red-blue quality bar just under the OCT will give you the best quality possible. And you can also look for the density of the retinal pigment epithelium. So here in this example, you can notice that the image on the right here of the OCT is really faded out and it's not there at all. And so what we're going to do is if we move the joystick to the left or to the right, you'll see that now it's faded out a little bit more on the left. Okay. What we're trying to accomplish here, all right, is the RPE layer, all right, and here down on the bottom, the dense black layer. We want to get that evenly dense from left to right as best as possible. And when you do that, the quality, the blue quality bar will also move up and down. So you can either do one of two things. You can look at the quality bar and get the best quality you can, or you can look at the retinal pigment epithelium and get that nice and evenly dense. And that's what I like to do, is to get that evenly dense as possible. You'll notice here that we have a pretty evenly dense image here, and if you notice our fundus image is nice and evenly illuminated, all right, and we've got a really nice quality OCT. So that's just a left-right movement with the joystick. If you're doing a vertical image, right, you want to do is just twist the joystick, rotate it left or right, very similar to what we just did here. All right, so here you can see the scan goes vertically. The left side of the image is a little bit less dense than the right-hand side, so we're just going to twist that joystick. If we twist it a little bit too far, it happens the exact same on the other side. And once we kind of find a happy medium, we can really see we have a nice fundus image, and we also have a nice, dense retinal pigment epithelium and good quality also. Right. Sometimes with patients, as you move the camera forward, and you'll see this more so on an OCT plus or an HRA OCT, that as you move the camera forward, you kind of bottom out. And sometimes if the patients don't have the forehead up against the bar, you can't move the camera any further forward, so you have to pull the camera back, have the patient bring their forehead up against the chin rest, and sometimes even then it might be a little bit difficult to get the OCT in that upper third. If that happens, patients usually have deep-set eyes, or they may have a heavy brow or prominent chin that physically moves their eyes further back in the chin rest than a normal person. So what we like to do there is to select the longer length eye. On the new 5.1 software, you'll see this button that says Eye Control. If you click on that, here you will get the longer length eye controls. Right? This has nothing to do if the patient is myopic or hyperopic. The SPECTRALIS will focus anywhere from a +40 to a -26. So you should be able to get the patient in focus, but the OCT just does not come up high enough in the screen. And what this does is it changes the scan length of the OCT, the depth of the scan, I'm sorry, by 3 millimeters for every button. So M, if you would consider that a 0 point, L would be 3 millimeters, XL would be 6 millimeters. Same thing holds true with patients who may not have any lenses. If a patient doesn't have an intraocular lens or they lost their natural lens due to trauma and nothing has been put in yet, it's going to be the same thing, but what you're going to do here is you're going to select the shorter eye. All right. Volume scans, you'll notice here, the interface here has changed a little bit with the 5.1 software, but it's always measured in degrees. And the reason it's measured in degrees is because the patient's refraction is going to determine the length of the scan itself. Right? The smallest scan that we have is 15 by 5 degrees. The largest scan we have is 30 by 25 degrees. All right. And again, you can move or you can angle those scans. And each one of those blue lines there is a B scan. All right. We can also increase the density of those scans. For each scan height in degrees, so 5 degrees, 10, 15, 20, or 25 degrees, we have also 4 varying levels of density. So in that 15 by 5 degree scan line, there's 7 lines on all the way up to 49. All right, this is the acquisition scanning, the volume scans, the presets. So a volume scan is really an amount of space measured in cubic units that of an object or substance that it occupies. So again, you can either use the volume button on your control pad, or you can use the presets now in version 5.1. So the preset volume scans, the fast scan is a 20 by 20 degree scan area, right, and is done at high speed. The next button is a high resolution, which is also a 20 by 20 degree scan, right, but there are 49 lines in there as opposed to the 25 in the fast scan. A detailed scan, right, is a 15 by 5 degree scan with 49 lines in it. So it's a very small, very dense scan. So if you're looking to really get some detail out of an area, that would be something that you would use there. The next scan is the posterior pole scan. It's our largest scan. It's 30 by 25 degrees, and there's 61 lines in there to scan the whole posterior pole. The next scan is the optic nerve head. What you'll notice about the optic nerve head and also about the RNFL scan is if you notice the fixation target in the bottom right-hand corner of the picture, the fixation target is moved over. When you are now scanning the optic nerve head, or if you're scanning the RNFL, when you move the camera from the left eye to the right eye, it's going to automatically change the fixation for you. So it's going to move that target to the left or to the right. So it puts the patient's optic nerve closer to the center of the scan of the window. So you can position that scanner, you can position that circle right over the optic nerve. And the next, the last preset scan is a 7-line scan. All right, and if you're just interested in the macula area, from the disc to temporally, this is a great scan for something like that. So what would I want to use these scans for? A fast scan is great for screening somebody with age-related macular degeneration, diabetic retinopathy, edema, or a macular pucker, or even an epiretinal membrane. So it's just more kind of used as a screening tool. High resolution is the same as above, all right, the same as the fast scan, but it just adds in more B scans so that you can get some extra slices. The detailed scan, again, as I mentioned earlier, is when you want to get an area of interest in a short amount of time. If you're looking for something small, maybe like a macular hole, you're interested in vitreous macular traction, or just macular edema, right? Or just a small area that you want to get a really nice high detailed scan on. Posterior pole can also be used for screening. If you're looking for somebody who has very severe proliferative diabetic retinopathy, maybe like a hemiretinal vein occlusion or an artery occlusion, or if there's just a very large area of pathology, that would be a good scan for that. The optic nerve head is good for obviously just scanning the optic nerve, or if you have some choroidal neovascularization that happens to be right next to the optic nerve, you can do a volume scan right through there. And the 7-line scan is a good quick evaluation of the macula, like again the macular hole, pucker, edema, or vitreal macular traction. So what I like to do is I like to select, I like to start out with the fast scan and identify any areas of interest. And then I match the scan volume size to the pathology. So if I'm imaging somebody who's a severe proliferative diabetic, I'll go to the posterior pole scan, or I'll increase their or lower the volume scan if I'm only interested in the fovea, the macula. Right? And this is really nice and easy to visualize if you're doing a fluorescein or an ICG. So you can really see that specific area of interest. If you have an area that happens to be very hyperfluorescent, you can really choose the proper scan for the pathology, for the area of interest that is either hyper or hypofluorescent. Right? So here, if we're just interested in the macula, here we can see there's an area that may have some traction in there. You know, we can scan the whole area, but if the patient's vision is really being affected, we may want to go to a smaller dense scan, like the detailed scan from the posterior pole scan. And so we can go and just get that detail, that small detail there in the fovea, and really look at that, that macular pucker or that epiretinal membrane. Right. The other thing it obviously allows us to do is to get that volume data, right, to really kind of look at the retina as a whole in, in a volume format so that we can scan through all these different images and get a topography view of the retina itself. Right. So there are also, besides the preset scans, the fast, the high-res, and the detailed scans, there's also section scans, the line, the circle, and the radial pattern, but also one of the section scans is the RNFL scan itself. So again, that line can go horizontal, right? It can go vertical, and you can also change the length there in between by just grabbing the tip of the arrow and moving it left or right, all right? And you will be able to angle that scan, and you'll also be able to make it shorter or longer, either 15, 20, 25, or 30 degrees. All right. The circle scan or the RNFL scan, obviously for your glaucoma patients, so you can measure the retinal nerve fiber layer. Right?
I have a question here.
Yeah.
How do you get all the preset volume scans? In other words, are they displayed on the screen?
They are. All the preset scans, when you get the new version of the software, on this slide here where it says preset, they will be right on the screen itself, right underneath the OCT window. Right? All of these little buttons here, fast, high-res, detail, posterior pole, are right there on the screen. So you just click on which scan you're interested in, and it will automatically go to that preset number of lines and area. So if it's 20 by 20 degrees, if it's 20 by 30, or 15 by 5. Excellent. Does that answer the question?
Yes, that's perfect. Thank you.
And you'll see some pictures here in a little bit of, again, of what the interface looks like when you're actually taking the picture, and I'll point that out again so that you can see that. All right. So again, and then we have our star pattern here also. Again, and you can also change the density and the length of that too. All right, and any of these scans can also be moved around. You can grab the center of the scan and you can move it left or right or up or down, and in any position, and angle. Okay, RNFL scans. With the new 5.1 software, here again you can see, right, this is going to be what your new acquisition window is going to look like. Right? And if you notice just below the OCT, it says presets, and there are all of your preset scans. Right? So if you want to choose RNFL, you would just pick RNFL, and if you notice, when that scan is chosen, towards the bottom on the right-hand side, the 9 blue squares, it's going to automatically move that fixation target over there for you. Right? So when you select the RNFL scan, it's going to automatically move that fixation target to the nasal side, and the default is going to be 16 art mean frames. So it's going to average 16 frames together. So again, you want to line that patient up, get a nice evenly illuminated fundus image, move the camera forward, and then you can see your OCT. Okay. For those of you who have an OCT Plus or an HRA OCT, right, basically if you have a touch panel, you're going to want to change that magnification there to 20 degrees. Right? For those of you who have an OCT, right, one where the optical head stays fixed, you cannot do this. Right? And the reason we have you change it to 20 degrees is it tracks the eye better, right, and faster. Actually not better, but it tracks it faster, so you can take the images slightly quicker, and it acquires those 16 frames a little faster. All right. Then we want you to turn on ART. All right. We want you to activate the eye tracker by pushing the black button on the control pad or holding the button down on the joystick for about half a second, and that's going to activate the eye tracker. All right. So you can see the difference here. And now that the eye tracker is on with the live images down in the bottom, right, then what you're going to want to do is then move the circle over the optic nerve. So what that does is, in the large window, the one with the green, you can see the green bar on it, okay, the two green lines, it's now locked onto that image. The image is stabilized, it will not move, and you can position that circle exactly over the center of the optic nerve and get that blue circle equal distant around the optic nerve. And also what you'll see too in the 5.1 software is a little tiny plus symbol in the middle of the circle scan. Right? And that's going to help you center that a little bit better over the optic nerve. Once you've got that centered over the optic nerve, make sure that all of your images look good. You've got good even density on the OCT, that the OCT has not been cut off, and then just click Acquire and you're all set to go. Okay, so this is just a slightly larger example of what we want to do. You want to, again, get that good fundus image, get a good looking OCT, right? Change to 20 degrees if you have that option, if you have a touch panel, and then turn on the eye tracker and move the circle right over the optic nerve and then click Acquire. Okay. Now, creating a custom scan. If there are scans that you specifically do a lot for a specific doctor, or like I said, if you're involved in clinical trials through the University of Wisconsin or some other reading center like DART, like that, there are scans, you can customize scans specifically for these studies. So what you want to do is, here we happen to be clicked on a detailed scan here. So what we're going to do is we're going to modify the scan a little bit. If you notice, we clicked on detail. The scan length is 15 by 5 degrees. It's 49 sections, and so there's 49 lines in there. All right, so we're going to set that scan up exactly the way that we want it. All right. All right, so now we're going to rotate that scan a little bit. So if you notice, what we did is we moved it from 16 ART frames to 25, right? And we've also changed the scan now vertically. All right, so what we're going to do is we're going to click on the Customize button just to the right of the preset, and we're going to hold that button down for 3 seconds. Once we hold that button down for 3 seconds, a little window is going to come up, and we're going to give the preset a name. And I just happen to call this one High Resolution Vert for Vertical. Right? And then once I click OK, now if you notice, one of the Customize buttons here, it says HR Vert for Vertical. Right? So you can customize up to 4 different scans. Okay. Eye tracking. Active real-time eye tracking allows us to sample up to 100 B scans to reduce the noise. All right. So here again, on the new software, you can see the preset here for the fast scan happens to be an ART frame of 9. Right. The more frames we sample, the less noise there is in the image. All right. You can sample as many as 100 frames. Right? You can sample as few as 2. Okay. And when you take the picture, you'll notice that where it says ART frame of 9, there's a little blue bar that will go up. And as it acquires each B scan 9 times, it's just going to continue to move on up through the whole volume scans. All right. So like I said, the more frames there are, right, the better quality of the images, the less noise there is. And all the presets, it's already been preset for you. So the reason we do this is, if you have a single scan, right, and the patient moves around, you introduce eye movement or motion artifacts. With the SPECTRALIS, we're using two beams, one as our reference scan to lock onto the eye, and the other one, and then the reference scan talks to the cross-sectional scan, and as the patient's moving, they talk to each other, and the scan line moves along with the patient's fixation so that we can scan the exact same area every single time the patient comes in. Okay? So we activate that by touching the arc button on the touchpad, or if you have a joystick mounted, if you have a joystick button on your camera, if you just hold that button down for about 3 seconds, it will lock on, it will activate the eye tracker. So now, again, when you're taking OCTs with the new 5.1 software and the multimodality image alignment, if we take a picture, say of this particular patient, here are all 6 imaging modalities that the HRA OCT can do, right? You'll notice that each image looks slightly different. So if a patient came in the very first time and we did an ICG OCT, right, the patient comes back next time, we're not going to do an ICG, but we're going to do an infrared image, all right? We can still reference the FA-ICG and do we can do an ICG OCT, and later on down the line, we can do an infrared OCT, or even an autofluorescence OCT. So now with this multi-imaging that we can do, we can cross-reference different modalities and our OCTs together. All right? So here's just a couple of different examples of an infrared OCT, a fluorescein OCT. Here you can really see where the areas of interest are. So if you're going to do a volume scan, you can target now, with the volume scan, you can target those areas of interest of hyper or hypofluorescence. Right? Autofluorescence, it's the same thing. ICG, here you can see on the ICG there's, on the fundus image, there's just a little bit of an area of interest there that we happen to scan through, and on the OCT, you can actually see where the choroidal neovascular membrane has popped through, or wrap lesion may have popped through the retinal pigment epithelium. So now that we have all of these different imaging modalities, okay, following up with the patient. Patients, when they come back a month, 2 months, 6 months, a year later, how do we really go about doing the follow-up? The follow-up allows us to repeat that OCT scan, whether it's a single line, whether it's a star pattern, or whether it's a volume scan in that exact same location. Right? An image must be defined as a reference image. And so what we're going to do is we're going to look at a particular patient, and what we're going to do is we're going to right-click on the thumbnail of that image, and we're going to say progression and then set reference. And what that does is that's going to place a red icon on that image. So when we go to take the picture, we're going to align that image and make it look as good as possible as it did before. So we're going to align the HRA image, the fundus image, along with the OCT, right? And then if you notice, there's a little button here that says follow-up. We're going to click on that follow-up button. When we click on that follow-up button, you can now see the image that we right-clicked on earlier and selected the reference. Once we select that reference, we're going to just double-click on it or press OK. We're going to scan that exact same area, and here you can see where the fundus image is now tilted a little bit. You can see the green box there, which means the eye tracker is active, and we're actually tracking the eye. The scan is now tilted a little bit, counterclockwise, and once we click Acquire, right, we can see the baseline window here, and then when we click Acquire, all right, it will adjust for any rotation or any fixation movements on the patient's part. The other thing you want to check for is focus. If you notice a little focus down here, if you're within one diopter, there's 2 focus numbers here, they both say minus 25 diopters. If you're more than a diopter off, that's going to be red. All right. It's not going to affect the scan at all, but what you may notice is that the fundus image may be slightly out of focus. So when you're within a diopter, it's going to both focus numbers are going to be black. If you're more than a diopter off, one will be red, one will be black. You want to get them as close to each other as possible. All right, you're going to click Acquire, all right, and you're going to notice that your art frame is going to be set exactly to what it was before, all right, and you're going to have now a new icon with the checkerboard being in the middle. So the one on the left, red is always referenced. So that was the image we referenced earlier, and then the one on the right is our new icon, which are the two which is the follow-up image after the reference image. So, and this is, a typical, this happens to be a single line scan for a follow-up registration. And you can see here that on this printout, and you can see the progression of the central serous choroidal retinopathy and how the retina has actually gotten thinner. Right? And we followed it up in the exact same location. Right? Follow-up registration on a volume scan, you're going to really see this with the thickness map. So the first exam is going to be here in the center, and it says reference thickness, and then the top one says, the second exam says follow-up thickness, and then you have the difference map below that. So if there's an area that's thicker, it's going to appear in red. If there's an area that's thinner, it's going to appear in green. Okay. If you do a volume scan and you don't want to necessarily go through the whole volume scan on a follow-up image, you can isolate one B scan on the follow-up. Right? You can extract one particular image. If there's one scan that the doctor is really interested in, you can extract that one B scan out of there and just do the one line on that patient for later. So what you're going to do is once you identify that particular line, all right, so if this is the scan that happens to be of interest, you're going to go to the image menu and then extract as a single image. So you're going to pull that one line out of this whole series here. So there's our one scan. All right, and then I can go to the progression menu and mark that as my reference. And then once I have that marked as my reference, I can then go back through and go through the same steps to do my follow-up there. Okay, so just as a review, importance of camera alignment. The more aligned you are in the image, the better the quality of a scan you'll get. All right, you really want to line up that fundus image or that HRA image first, then align the OCT. Okay, using the sensitivity controls to really control any overexposure or underexposure of that fundus image. If you happen to have an OCT plus or an HRA OCT, again on a SPECTRALIS OCT, that's going to be done for you automatically. Don't forget to use the different preset buttons to really match the size of the volume scan to the pathology, right? And if you happen to want to do higher mean frames, all right, you'll reduce more noise and you'll get a better quality image. And eye tracking is an intricate part of what we're the images that we're taking, and just remember just kind of how that works. And again, the more mean frames you have, the better quality the pictures will be. And again, you can select your different reference images. So again, if you're doing multimodality imaging after the 5.1 software, once you get the 5.1 software, you can use any type of modality to image your patients with, especially on follow-ups. And then setting the reference scan, being sure to do that so that you can do your follow-ups, and just going through all of your follow-up scans. So you can, when you do your follow-up scans and making your prints, so that your doctors can really follow and track those patients along over time. Right. I would try to give special thanks to Dr. Alexander Walsh, who provided some information on some of the slides that you saw here today, and also the University of Houston Biomedical Optics Lab, providing the slides on the differences between time domain and spectral domain OCT. All right. If you have any questions, I'd love to entertain them now.
Excellent. Thank you so much, Tim, for that excellent presentation. We have a couple questions.
Mm-hmm.
In Spectralis OCT image, how do you get the horizontal sectioning at the RPE or choroid level?
How do you measure the RPE or the choroid?
You just said, how do you get the horizontal sectioning at the RPE or choroid level?
Okay. It sounds like the question is being asked how to measure just the retinal pigment epithelium and the choroid. If you want to do that, what you're going to have to do is you're going to have to move the segmentation lines yourself. If you go into the thickness profile view, you'll notice that there is an arrow with a red line, and you can click on that icon, and then you can click on the scan line, or you can click on the segmentation line, I'm sorry, and then you can move those segmentation lines to where you want them to get a specific measurement. So instead of measuring the whole thickness of the retina, if you want to measure just a portion, you can move those lines yourself. Hopefully I'm asking that, or answering that correctly.
Thank you. That was great.
Actually, you know, I think the question has changed. It's actually, how do you get choroidal images better? Okay. If you're looking to image the choroid, you really want to get a good, nice high density image of the choroid. Yes, mirror the image itself. So push the joystick forward a little bit, flip the OCT or mirror the OCT, keep it in the upper 1/3, and you'll be able to image the choroid better.
That's excellent. That was actually our second question, so thank you so much for answering that.
Right.
Another one, sometimes the image is not even for high myopic patients, and we have dark areas in some corners. Is there any way to avoid that?
No, there isn't. Sometimes if you think of a myopic eye, it's more shaped like a football. If the image in the OCT is at the upper third, and you do have some vignetting on the corners, right, or it is darker on the corners, you can do one of two things. You can hit the small icon for the eye length control, and you can move the camera forward a little bit, right, and get a more evenly illuminated picture. But sometimes when you do that, depending on how myopic the patients are, the fundus image may be in or out of focus a little bit. If you have somebody that's probably like a -12 or -15, you'll get that vignetting a little bit. That's okay. You know, not everybody is going to be a perfectly pristine fundus image. You know, you got patients that have cataracts, medial opacities, patients with long eyes. As long as your quality of your OCT looks good, you've got good even density on the retinal pigment epithelium, you're okay. And if you got a nice good quality on the quality bar, you're okay. The vignetting on the corners, you know, may not be ideal, but we're dealing with real-world patients here. So as long as you've got good even illumination on the RPE and a good quality in the quality bar, you're okay.
Thank you. And another question, is it possible to study the choroid on the Spectralis?
By studying the choroid, I'm not sure what you mean by studying the choroid. You can image it, obviously, and you could, even if the image is rotated and flipped, you could still mark that image as a reference, and you could image that later. You know, you can do all the things that you could do if the image is flipped or if it's mirrored, but the word study, I'm not sure what you mean by the word study. Likewise.
Perhaps you could further elaborate on that question if you want to type that in. He said that was a good answer, so thank you. That answered his question. All right. Well, we'll wait just a couple more minutes if anyone has any more questions. In the meantime, I'm going to go ahead and display our customer support options. We have excellent customer support here for you. You can access our webinars online. And please let us know if there's anything you'd like to see presented in the future. This helps us with our upcoming Heidelberg Engineering Academy courses. And if you would, please take a minute to fill out the evaluation form that you'll see when you exit your WebEx session. All right, it looks like we are not getting any more questions. So with that, I would like to say thank you again, Tim, for that wonderful presentation.
Oh, you're welcome. Thank you.
And for those of you on the East Coast and in the Midwest, have a wonderful evening. And for those of you here on the West Coast, enjoy the rest of your afternoon. And to all of you, thank you again for joining the Heidelberg Engineering Academy.